The human eye is one of the most complex organs in the body and is responsible for our sense of sight. Vision loss can have a significant impact on a person's daily life and well-being. Dr. Kia Washington is the Director of Research and Professor of Plastic and Reconstructive Surgery at the University of Colorado School of Medicine on the CU Anschutz Medical Campus. Her work to restore vision through whole eye transplantation, a procedure that has never been successfully performed in humans, is so promising, the U.S. Department of Defense Joint Warfighters Program awarded her a $6 million grant to further her research.
I'm Kia Washington, and I'm a plastic and reconstructive surgeon here at the University of Colorado Anschutz Medical Campus. I have a subspecialty in hand and upper extremity surgery, which is the majority of my practice. As part of my training, we do a lot of surgeries in the face and around the orbit or around the eye. And a lot of face transplant candidates actually have been blind. So the thought is, well, what could we also transplant to help people, including the face? Transplanting the eye has always been kind of an option to think about with vascularized composite allotransplantation because you can restore probably the most important sense, which is sight. But we were fortunate to receive approximately $6 million from the Department of Defense through their Joint Warfighter Medical Research Program. And this really gave us the foundation to really launch our project. We were able to get funding from the Department of Defense, which we could use to do basic science research to forward the field, which to our knowledge is the first orthotopic model for eye transplantation. And that means that the eye is transplanted into its anatomic position. And then we connect things like the optic nerve, which is the nerve that restores vision. We also connect some of the soft tissue and the muscles from the face as well. It's going well. It's a slow process, as you can imagine. And it's high reward, high risk research. It's very ambitious. And we've learned that we're able to restore the blood flow to the eye, to the transplanted eye. We're able to restore some of the fluid dynamics called the aqueous humor. And we studied that through various mechanisms. We're looking at ways that rejection, when a transplant is rejected by the body that it's transplanted to, we're looking at ways to solve rejection and to define it in the eye. And we're also obviously looking at ways to regenerate the optic nerve. This is the most important part of the transplant, that's the nerve that restores sight. So in order for that to happen, that has to regenerate. And obviously that's a big obstacle. There are several laboratories throughout the world working on optic nerve regeneration. We have several collaborators, and we're fortunate to have a great team. It definitely is technically feasible to do this actual surgery. So we just need some aspects of science to come together, and I do think it will be feasible in the next couple of decades.
The groundbreaking research by Dr. Kia Washington at University of Colorado School of Medicine is changing the way we see the world. This is where the brightest minds in medicine bring passion and science together with technology, creating endless possibilities to better your life.